Now, ever since he came down the escalator at Trump Tower to start his campaign, President Trump has been making a big deal about making America first. Well, he seems to have succeeded, well, at least in one area, because the United States now has more coronavirus cases than any other country on Earth. And if that's not enough, the United States also has one of the most worrying trend lines as it concerns the continued growth rate of COVID-19. So not only is it very bad already, but it is promising to get much worse. And we all know that what that means is increasingly large parts of the country are completely shut down and everything else is moving significantly slower. Now, this practice of physical distancing serves a vital public health purpose of flattening the curve. And it takes about 2 weeks for the impact of these shutdowns to start showing up in the data as it concerns flattening the curve, and there are some mildly encouraging signs, so certainly your sacrifices aren't totally in vain. That being said though, while you're sacrificing, the government is supposed to be working to create the conditions to lift the lockdown, namely expanding healthcare capacity to identify, hospitalize, and treat all who need it. This, however, is exactly the area that the powers that be are failing the most. The news is filled with stories of critical shortages of crucial medical and protective gear for frontline health workers and workers at essential businesses like, say, grocery stores. And that's not to mention the fact that physical space is now at a premium, at least as it concerns medical facilities, as hospitals are starting to overflow. And in fact, the Trump administration has actually introduced serious delays into the ventilator production process because they were being asked to pay $1 billion to a partnership between GM and Ventec. Yes, $1 billion at a time where they are handing out hundreds of billions of dollars like candy to Wall Street. And to add insult to injury, President Trump even questioned the need for large numbers of ventilators.
New York is a bigger deal, but it's going to go also. But I have a feeling that a lot of the numbers that are being said in some areas are just bigger than they're going to be. I don't believe you need 40,000 or 30,000 ventilators.
Now, after outrage mounted about these actions and comments, Trump backtracked, saying he was now ordering GM and Ventec to start producing ventilators from this previous deal. Be that as it may, and whatever face saving that Trump is trying to do here, all of this has been leading to a growing outcry for the federal government to nationalize at least the medical supply chain and start producing more critical items, obtain necessary space, and rationally distribute everything being produced. And most of that conversation is revolving around the issue of something called the Defense Production Act, or DPA for short. The Defense Production Act originally passed in 1950, and it's basically just a set of rules that allow the president to effectively nationalize parts of the economy, particularly in manufacturing, for the national defense. Now, the act applies the concept of national defense to emergencies like this one that are officially declared as such by the government under the Stafford Act. And once that authority is put out there, the DPA allows the president to do a whole variety of things. For example, if a company can make X number of masks a day, using the DPA, the government could say, you will make X number of masks for us, and then the government would take the masks and then distribute them as public health needs determine. The act also allows the government to install new equipment, for instance, to retool a plant. So if you can retool a factory, and this goes back to the General Motors issue, if you can retool a factory to make ventilators, which of course General Motors is not the only one, there's several other companies working on this, then the government could order all similar factories to retool to make ventilators. Then the government could purchase and install any new equipment necessary to make that possible using either its own money or by guaranteeing a loan to these companies to buy the equipment to retool the plant. So, rather than what we have now, where companies just make what they can and states and private entities compete to buy it, you would have a system where need would be determined, orders would be sent out, and goods would be distributed. This way, not only is production expanded, but the things that are produced actually go to the areas, both sectoral and geographical, where they can have the biggest impact in combating the coronavirus pandemic. Now, some have pointed out that there are particular challenges with elements of the act that could create some roadblocks there, particularly some caps on spending, but there's one simple solution. Congress just has to amend it. That being said, though, there's another consideration that new legislation, more specific to this pandemic situation we are in, be passed to facilitate the nationalization of critical industries and sectors. Because in addition to equipment, there's another area of critical shortages, and that's trained medical personnel to be able to treat patients and operate the equipment that's being produced. You can't make nurses the same way you can make masks. Our medical infrastructure is heavily imbalanced, and we need more healthcare workers. So how do you manage, allocate, and pay for a nationwide mobilization of medical professionals? Furthermore, so many of the workers who are essential to fighting the virus are workers in the production, distribution, waste management, and construction sectors, and that's just to name a few. How do we manage, mobilize, distribute, and protect the essential goods that allow us to facilitate best public health practices? It seems like the only answer to that question is that, in addition to the medical supply chain, we need to nationalize other key critical sectors to make sure that everyone can get the care that they need and the things that they need to stay healthy during this pandemic. The Defense Production Act was designed and suited for a war. And this is a war of sorts, but it's not for destroying others, but it's for caring for one another. The deep inadequacies of our current system means our need for expansion and democratic control over key parts of the economy will last beyond this emergency, and we need new laws that reflect and enforce that.